So trauma therapy is traditionally very hard for people to engage with and stay with because it's so uncomfortable. And with 3MDR, it makes it so much more tolerable for them. They're able to go through and complete in a shorter period of time, and they're able to access themselves in a way that they haven't had access before in other treatments. My name is Katherine Bright, and I'm an assistant professor and assistant chair in special programs at the School of Nursing and Midwifery at Mount Royal University. Yeah, so my research really focuses on women's mental health across the lifespan and looking at different types of treatment that we can be using that are helpful for women. We have an international consortium, and we're working with interdisciplinary members from psychiatry, occupational therapy, psychology, nursing, computing science, and we're all working together to really try and make impactful change with trauma treatment. I think that there's been lots of articles that have been written about the value of just getting out in nature and walking. And so with 3MDR, they're on the treadmill and they're walking. And what this does is it helps them to not dissociate. It helps them to stay in their body. One of my colleagues once said, we are broken in relationships and we are healed in relationships. And I believe that to be such an essential part of 3MDR is this time that we spend with them, the 2 hours that we spend every week for up to 10, 12 weeks with them, because it changes their perspective of what the world was. It's no longer unsafe. There are people that they can be safe with. Right now, we've been working with some really amazing undergraduate students and students who have recently graduated to make sure that we tell the story correctly about patients.
Sitting in a classroom and kind of learning about theories can only really go so far to help your understanding. And I think the real benefit of doing research is you get to see all the stuff that you talk about in class and write papers on really be applied in a concrete way.
As part of the manuscript writing process, we are able to send this out to the participant to review. It's really important that when they're reading the manuscript, they feel like they're being well represented and that their story is being well represented.
Quite often what we'll hear is, that's exactly what happened. Do you know how validating it is for it to be seen in words, for it to be written on a piece of paper? I was seen, I was heard, I was validated. That's the most important part.
Through the 3MDR process, they're able to understand their PTSD a lot better. They're able to manage their symptoms more. And so with that might come a bit of a difference in how they understand their story.
I've got to watch all kinds of different people go from things that have haunted them and they've been carrying their entire lives to within a couple of sessions being able to truly engage with their life again. And that's very, very inspiring.
Sometimes participants have described it as almost this tapestry of life where they see this theme that has been woven through. So it's manifesting now when they're in their 50s or 60s, but what they actually saw was, I felt that way when I was 15. I felt that way when I was 7. It's been throughout my whole life I felt this way, and now I'm seeing it for what it is. There was something underlying it, and now we're getting to the root cause of it.